Bismillahirrahmanirrahim. Assalamu alaikum. Today inshallah we will discuss the lumbar vertebra. First of all, we should know that what are the bones which are present in the region of abdomen. The various bones which are present in relation to abdomen are 5 lumbar vertebra, the sacrum and the bony pelvis. See here in this diagram, these are 5 lumbar vertebra. They are attached with the sacrum, and sacrum is attached to 2 hip bones on each side to form the bony pelvis. These are 3 bones which are present in the region of abdomen. Now we will discuss the lumbar vertebra. There are 5 lumbar vertebra, out of which the first 4, number 1, 2, 3 and 4, they are typical, and the 5th one, which is the lowest one, this is atypical. A lumbar vertebra is identified by its large size and by the absence of the costal facets on the body. The costal facets are present in the thoracic vertebra because the ribs are present in the thorax and which are attached to the thoracic vertebra. For the ribs, there are some facets on the body of the thoracic vertebra. So as there are no ribs in the region of abdomen, so there will be no costal facets here. Now we will differentiate between the cervical, thoracic and the lumbar vertebra. If we see the cervical vertebra, the vertebral body is very small. See here, this is the body, this is very small. In thoracic vertebra, the body is medium sized and it is heart shaped. See here, this is heart shaped body. And the lumbar vertebra, the body is large, massive, and it is kidney shaped. We can remember the shape of the thoracic and the lumbar vertebra by one viscera that is present in the region of the thorax and the abdomen. What are they? Number 1, heart is present in the thorax, so the body of the thoracic vertebra is heart shaped. And kidneys are present in the region of abdomen, so the lumbar vertebra, they are kidney shaped. The body is kidney shaped. Now we will discuss the foramina. What are the foramina which are present in the cervical vertebra? If you see here, there is one vertebral foramen. See here, this is vertebral foramen, and there are 2 transverse foramen which are named as foramen transversarium. They are present in the transverse processes of the cervical vertebra. This is the differentiating feature of the cervical vertebra. If you see the foramen transversarium, you can identify that this is cervical vertebra. These foramen transversarium, they are absent in the thoracic vertebra and in the lumbar vertebra. Okay, so there are only one vertebral foramen which is present in the thoracic and the lumbar vertebra. Now we will discuss the spinal process. See here, this is the spine. This is very short and bifid spine. That is, there are 2 branches of the spine in the cervical vertebra. In the thoracic vertebra, the spine is long and it is inclined forward. And in the lumbar vertebra, again, the spine is short, but here it is broad, flat and quadrilateral. Okay, if you see here in this diagram, you can see that the spine is quadrilateral. That is, there are 4 angles, okay, or 4 corners are there in the spine of the lumbar vertebra. Then the transverse processes. See here, there is additional transversarium, foramen transversarium in the transverse process through which the vertebral artery will cross. Okay, and there is a vein and the sympathetic nerve which is passing through this foramen transversarium. In the thoracic vertebra, the transverse processes, they will have the costal facets. See here, these are the costal facets because the ribs, they are attached not only to the body of the thoracic vertebra, but they are also attached to the transverse processes of the thoracic vertebra. In the lumbar vertebra, the transverse processes are long and cylinder. They are conical shaped. Okay, so these are the differences of the vertebral body, the foramen, the spine and the transverse processes in the cervical, thoracic and lumbar vertebra. See here, this is the 5th lumbar vertebra, which is the atypical one. This is the body. The body is massive and kidney shaped. This is the vertebral foramen. Okay, there is one vertebral foramen in each vertebra. These are the conical transverse processes. See here, these are the transverse processes. This is superior articular processes. There will be inferior articular processes. These are the pedicles. Pedicles are those processes which are coming out from the body, and these are the lamina. The pedicles and the lamina, they are present at the junction. The pedicles and the lamina, they are present where from where the transverse processes are coming out, and the lamina will join together at the back from where the spine will come out. Okay, so this part, the pedicles, the transverse processes, the lamina and the spine, they will form the vertebral arch. This is called as vertebral arch. This is the spine. This will be quadrilateral in the lumbar vertebra. See here, these are the vertebral bodies. There are some attachments here which are shown. This is anterior longitudinal ligament which is attached to the anterior part of the bodies of the vertebra. Then there is posterior longitudinal ligament. This one is the posterior longitudinal ligament. Here you can say in the intervertebral area, this is the area which is present in between the above vertebra and the below vertebra. This is the intervertebral disc. This intervertebral disc is composed of two structures. There is annulus fibrosus which is outside, and in the center there is nucleus pulposus. Okay, so this is anterior longitudinal ligament. This is intervertebral disc. This is posterior longitudinal ligament. In the intervertebral foramen, you can see the spinal nerve. This is spinal nerve which is present here in the intervertebral foramen. Okay, this is spine, the quadrilateral broad spine of the lumbar vertebra. And this is the supraspinous ligament which is present above the spine. This is supraspinous ligament. And here on the inside area of the spine, there will be the ligamentum flavum. This is ligamentum flavum, and in between the spines there are interspinous ligaments. Okay, this is interspinous ligament, that is the ligament which is present in between the spines of the vertebra. Now we will discuss the typical lumbar vertebra. Typical lumbar vertebra are four. Vertebra number 1, 2, 3 and 4. They are above vertebra or upper vertebra. So the body is large. See here, the body is very large. It is wider from side to side than from before backwards. If you see here, this anterior posterior diameter is less as compared to the transverse diameter. So the body is wide from side to side than from before backwards. The height of the body is slightly greater anteriorly. If you see here, the height of the body is slightly greater anteriorly as compared to the posterior length. This difference contributes to the forward convexity of the lumbar spine. See here, there will be forward convexity of the lumbar spine. The vertebral foramen, see here, the vertebral foramen is triangular in shape and it is larger than in the thoracic region but is smaller than the cervical region. You can compare here, in the cervical vertebra, the vertebral foramen is larger, but as compared to the cervical vertebra, the vertebral foramen is smaller in the lumbar vertebra, but it is larger than the vertebral foramen which is present in the thoracic vertebra. So it is triangular in shape. It is larger in this vertebral foramen is larger than in the thoracic region and smaller than in the cervical region. See here, this is anterior convexity of the lumbar spine. Because of the length which is present in the anterior side or anterior part, the length is greater. So it will form the anterior convexity of the lumbar spine. This is lumbar vertebra number 1, 2, 3 and 4, and this is the fifth atypical lumbar vertebra. These are the intervertebral disc. See here, these are the spinal nerves which are coming out from the intervertebral foramen. This is spinal nerve. Okay, lumbar spinal nerve. Okay, this one is L1, this is L2, this is L3, L4 and L5. Okay, here you can see the anterior convexity of the lumbar spine. This is cervical part, this one is the thoracic part, and this is the lumbar part. Okay, here you can see the cervical vertebra, you can see the big vertebral foramen here, then the small foramen transversarium in the transverse processes, okay, and the body is very small. But the thoracic one, the body is somewhat larger, the vertebral foramen is smaller, and there are the transverse processes with the costal facets, and there is a long and slender spinous process here. But in the lumbar vertebra, the body is massive. The vertebral foramen, it is again bigger than the thoracic vertebra. Then here, there are two transverse processes which are quadrilateral in shape. Then this is the spinous process. Okay, spinous transverse processes are big, but the spinous process is quadrilateral in shape. The pedicles are short. See here, these are the pedicles. They are very short and strong. They project backward from the upper part of the body so that the inferior vertebral notches, you can see here, this is the inferior vertebral notch. They are much deeper than the superior one. This is superior vertebral notch. It is shallow, but this is the inferior vertebral notch. It is much deeper. Okay, then we will discuss the lamina. See here, these are the lamina. This is the lamina. They are short, thick and broad. They are directed backwards and medially to complete the vertebral foramen posteriorly. See here, this is vertebral foramen. These are the two pedicles of the vertebral arch. Then there will be two transverse processes, and from the transverse processes there will be two lamina which are completing the vertebral arch posteriorly. Then there is a spine. The spine is quadrilateral, it is vertical, and it is directed almost backwards and only slightly downwards. See here, it is slightly downwards only. It is thickened along its posterior and inferior border. See here, this is the posterior border of the spine and this is the inferior border of the spine. They are thickened at the posterior and the inferior border. Now we will discuss the transverse processes. See here, these are the transverse processes. They are thin and tapering. See here, this is thin and tapering, and they are directed laterally and slightly backwards. They are homologous with the ribs in the thoracic region. The posterior inferior aspect of the root of each transverse process is marked by a small rough elevation. Okay, at the transverse process there will be a small rough elevation that is named as accessory process. Where the accessory process will be present? Accessory process is present at the posterior inferior part of the transverse process. Okay, and this accessory process, it will represent the true transverse process of the vertebra. See here, this is the true transverse process of the vertebra. Although the whole of the transverse process, it is homologous to the rib, but only the accessory process which is present on the posterior inferior part of the transverse process, it is the true transverse process of the lumbar vertebra. The length of the transverse process increases from vertebra L1 to L3 and thereafter it decreases. If we see all vertebra, you can see here the length of these transverse processes, it will be increasing from L1 to L2 to L3, but then it will be decrease. See here in the L4 and L5, the length of the transverse vertebra will decrease. Now the superior articular processes. See here, there will be superior articular processes which are present in the superior part. They lie farther apart from one another as compared to the inferior articular processes. See here, these are the superior articular processes with the superior articular facets. They are farther apart from one another. Okay, but the inferior articular processes, they are not very much apart. Okay, these processes, they bears a concave facet. See here, they are bearing a concave facet which is facing medially and backwards. The face of these facets is medially. The posterior border is marked by a rough elevation. See here, there will be rough elevation present on the superior articular process, and that elevation is named as mammillary process. So there are two processes which are one on the transverse process and one on the superior articular process. The transverse process will have the another process which is named as the accessory process, and the superior articular processes, they are having the mammillary processes. Okay, so accessory process is present on the transverse one and the mammillary process is present on the superior articular process. Then the inferior articular processes, see here, these are the inferior articular processes. They lie nearer to one another as compared to the superior one. So the superior one, they are the more farther from one another as compared to the inferior one. The inferior articular process, it bears a convex facet. See here, there was concave facet on the superior articular process which was facing medially, but the inferior articular process will have a convex facet, and this facet will be facing laterally and forward. This is the medial face and this one is the lateral face. Here also you can see, because this is the lateral view, you can see the facet on the inferior articular process only, but you cannot see the facet on the superior articular process because the facet on the superior articular process is facing medially. Now the fifth lumbar vertebra, it is atypical one. There are most important distinguishing features which are present in the fifth lumbar vertebra. What are they? Number one, the transverse processes are thick, short and pyramidal in shape. Okay, they are thick, short and pyramidal. This is the transverse process. It will be thick, short and pyramidal. Their base is attached to the whole thickness of the pedicle. See here, the base of the transverse process will be attached to the whole thickness of the pedicle and encroaches on the side of the body. That is, it is in more line with the side of the body or more attached to the side of the body. The distance between the inferior articular processes is equal to or more than the distance between the superior articular process. This is the main difference which is present in the fifth lumbar vertebra. As we know that in first four typical lumbar vertebra, the distance between the superior articular processes was more and the distance between the inferior articular processes was less in each vertebra. But here what will happen? The distance between the inferior articular processes will be more or less near, equal, or they are farther apart from one another as compared to the superior articular processes. Then the spine, see here, this is the spine. It is smaller than the above four spines and it is shorter and it has a rounded tip. See here, the above four transspinous processes were quadrilateral, but the fifth one, this is rounded at the tip. See here, this is the body, this is the vertebral foramen, this is the transverse process which is thick, short and pyramidal in shape. This is superior articular facet. Okay, these facets, they are facing backwards and medially. They are medially. See here the superior articular facets, they will be near to one another in the fifth lumbar vertebra, but the inferior articular processes, they will be far from one another in the fifth lumbar vertebra. The facets on the inferior articular processes, they are facing laterally. They are laterally facing. The body is the largest. This one, the body is the largest of all lumbar vertebra. Its anterior surface is much extensive than the posterior surface. See here, this anterior surface is much extensive than the posterior one. The difference is responsible for the creation of the sharp lumbosacral angle, which is 120 degrees in an adult. What is lumbosacral angle? See here, this is the fifth lumbar vertebra and this is the sacrum. The angle between the fifth lumbar vertebra and the sacrum, this is about 120 degrees. This is lumbosacral angle. The pedicles are directed backwards and laterally. See here, these are the pedicles. They are directed backward and laterally. The superior articular facets, see here, this is superior articular facets. They are looking more backwards than medially. They are more directed backwards as compared to the medial superior articular facets in upper four lumbar vertebra. And the inferior articular facets, they are looking more forward as compared to the lateral face. They are laterally, but they are facing more forwards as compared to other four lumbar vertebra. See here, this is the fifth lumbar vertebra and this is the sacrum. This is the lumbosacral angle. Okay, fifth lumbar vertebra and sacrum, they are forming one angle which is named as lumbosacral angle. Here you can see the superior articular facets. These are the superior articular facets. They are far from one another, but the inferior articular facets are more farther from one another. This length is more greater as compared to the length between the superior articular processes. These are the transverse processes. This is the spinous process. Now we will study some of the attachments and some relations of the lumbar vertebra. See here, this is the body, this is the intervertebral disc. In the intervertebral disc we have the peripheral area which is named as annulus fibrosus and a central area which is named as nucleus pulposus. Okay, now we will discuss some of the attachments. What are the attachments? The upper and the lower surfaces provide contact with the intervertebral disc. See here, this is the lower surface of the above vertebra and this is the upper surface of the vertebra which is below. So this intervertebral disc is attached to the upper and lower surface of the vertebra. Then the upper and the lower borders, they give attachment to the anterior. See here, this is anterior longitudinal ligament and this one is the posterior longitudinal ligament. So these ligaments, they are attached to the upper border and the lower border, okay, in front and behind respectively. The anterior longitudinal ligament is present anteriorly and the posterior longitudinal ligament is present posteriorly. Lateral to the anterior longitudinal ligament, the right crus of the diaphragm. See here, these are the crura of the diaphragm. There is the right crus of the diaphragm which is present lateral to the anterior longitudinal ligament, and this right crus of the diaphragm is attached only to the upper three vertebra, and the left crus of the diaphragm will be attached to the upper two vertebra only. If you see here, the right crus will be attached. See here, the right crus will be attached to the vertebra number 1, 2 and 3. But the left crus will be attached only to the upper two vertebra. This one is the right side and this is the left side. So 1, 2 and 3, but the left one will be attached to the upper two vertebra. Behind the line of the crura, the upper and the lower borders of all lumbar vertebra give origin to the psoas major muscle. If you see here, this is the first lumbar vertebra, second one, third, fourth and fifth one. If you see the attachment of the psoas major muscle, this will be lateral to the crura, line of the crura, or behind the line of crura. These upper and lower borders, so this is the upper border and this is the lower border. Then again this is the upper border and the lower border. They are giving origin to the psoas major muscle. Across the constricted part of the body on either side, the tendinous arches are attached. The lumbar vessels, the great rami communicants from the sympathetic chain, and they pass deep to each of these arches. Okay, so here there will be the tendinous arches which are attached and the lumbar vessels will cross and the sympathetic chain will cross. See here, this is the body of the lumbar vertebra. This is anterior longitudinal ligament which is present on the anterior surface of the body. This is the posterior longitudinal ligament. These are the crura of the diaphragm. This is the right, this one is the left one and this is the right one. Right crus of the diaphragm will be attached to the upper three lumbar vertebra and the left crus of the diaphragm will be attached to the upper two lumbar vertebra. Okay, then these are some muscles which are present here. If you see, the first muscle is psoas major muscle which is covered by the psoas fascia. This is psoas fascia. Then there is another muscle which is present or attached to the transverse process and this is named as quadratus lumborum. Okay, so this is the quadratus lumborum. On the quadratus lumborum and the erector spinae, there is one fascia that is named as thoracolumbar fascia. This one is the thoracolumbar fascia. This thoracolumbar fascia will have three layers. This is the anterior layer of the thoracolumbar fascia. This one is the middle layer of the thoracolumbar fascia and this is the posterior layer of the thoracolumbar fascia. This thoracolumbar fascia is enclosing not only the quadratus lumborum muscle but the multifidus muscle and the erector spinae muscle. Okay, so these are three muscles which are present. Number one is the psoas major, number two is the quadratus lumborum and number three is the erector spinae. When we will remove the erector spinae, then deep to it we can see the multifidus muscle. This is multifidus muscle. Okay, so this is psoas fascia, this is thoracolumbar fascia, the anterior layer, the middle layer and the posterior layer which is attached from the transverse process to the spinous process. Okay, now we will discuss the vertebral canal. You can see here, this is the vertebral canal, which is formed by the union of all vertebral foramina which are present in the cervical, thoracic and the lumbar vertebra. The part of the vertebral canal, it is formed by the first lumbar vertebra. It contains, see here, the part of the vertebral canal which is present in the region of the first lumbar vertebra. It contains the conus medullaris. What is conus medullaris? It is the termination of the spinal cord. This level is very important. In exam it is asked that at what level the spinal cord ends. So this is the level of the first lumbar vertebra, and when the spinal cord ends, it forms one cone that is named as conus medullaris. So this conus medullaris is the end of the spinal cord, and it is present in the vertebral canal at the region of the first lumbar vertebra. Then the part formed by the lower four lumbar vertebra, L2, L3, L4 and L5. What is present here in the vertebral canal? Here there is Cauda equina. See here, this is the Cauda equina. What is Cauda equina? Cauda equina means horse tail. It is just like horse tail that all spinal nerves, they are present here and they are coming out from the spinal cord and gathering together as the horse tail. Okay, here there will be pia mater also. Okay, there will be dura mater also. See here, there will be the external phylum terminal of dura mater, then there is internal phylum terminal of the pia mater, and there is the Cauda equina. Okay, what is phylum terminal? Phylum terminal are the fibers or the nerves which are ending. They are forming the end of the spinal nerve. See here, the canal of all the lumbar vertebra, they contain the spinal meninges, that is the dura mater, and arachnoid mater and the pia mater. Okay, so you can see the conus medullaris at the region of the first lumbar vertebra. Then you can see the Cauda equina. This is the Cauda equina. Okay, and the termination of dural sac or all spinal nerve, they will be at the S2 level. The S2 level shows that here the dura mater will be terminating. This is the termination of the dural sac. So what we have learned in this diagram, we have learned that at L1 vertebra the spinal cord will finish. This is named as conus medullaris. Then there will be the spinal nerves which are coming out or gathering together and they are forming the Cauda equina. But at the S2 level you can see the termination of the pia mater and the dura mater. Now, what is vertebral arch? I have told before also that the pedicles and the transverse processes and the lamina, they are forming together the vertebral arch. The pedicles are related. Now, what are the relations of these vertebral arches? The pedicles are related above and below to the spinal nerve. If you see here, this is the pedicle. Above also there will be spinal nerve. See here, this is the spinal nerve which is present below the pedicle, and this is again below the pedicle there will be spinal nerve. So it is, or you can see here, if this is the upper part of the pedicle, then again there is the spinal nerve. So the pedicles above and below, they are related with the spinal nerve. Then the lamina. See here, the lamina provide attachment to the ligamentum flavum. Okay, you can see here the ligamentum flavum. This blue colored which is shown here is the ligamentum flavum. So it is attached to the lamina. Then the spine provide attachment to the posterior layer of the lumbar fascia. Okay, so there will be thoracolumbar fascia. Its posterior layer will be attached to the spinous process. As you can see here, this is the posterior layer of the thoracolumbar fascia which is attached to the spinous process, and the interspinous and the supraspinous ligament. You can see here this green color, this is interspinous ligament, and the yellow one, this is supraspinous ligament. So these two ligaments are also attached to the spinous process. Then there is the erector spinae muscle and the multifidus muscle, and there are some interspinal muscles also. You can see here the erector spinae muscle and the multifidus muscle, they are attached to the spinous process. So these are some of the attachments of the vertebral arch. Okay, because the lamina, the pedicles and the spines, they are forming the vertebral arch. Okay, see here again, this is the vertebra, this is the body, this is vertebral foramen, these are the transverse processes, this is the spinous process. Now what are the muscles which are attached to the lumbar vertebra? Number one is the psoas major muscle, Number 2 is the quadratus lumborum muscle. This is the quadratus lumborum. Number 3 is the erector spinae muscle. When we will remove the erector spinae, deep to it there will be multifidus muscle. Okay, then here you can see the transversus abdominis muscle and the latissimus dorsi. Okay, above the erector spinae and the quadratus lumborum there is latissimus dorsi muscle. Okay, on the psoas major muscle there will be psoas fascia, the quadratus lumborum muscle and the erector spinae. They are enclosed by the thoracolumbar fascia, which is having 3 layers. This is anterior layer of the thoracolumbar fascia. This one is the, you can see the middle layer of the thoracolumbar fascia. This one is the middle layer, and this is the posterior layer of the thoracolumbar fascia. Now the transverse processes. See here the transverse processes of the lumbar vertebra. The tips are giving attachment to the middle layer of the thoracolumbar fascia. Okay. In addition, the tip of the first process, if you see here, the first process, this one is the lumbar vertebra, and this is the tip of the first process. It give attachment to the medial and the lateral arcuate ligament. See here, this is the medial arcuate ligament, and they have shown the lateral arcuate ligament also. This one is the medial arcuate ligament, and this one is the lateral arcuate ligament. So they are attached to the tip of the first lumbar vertebra. And the tip of the fifth process, it will give attachment to the iliolumbar ligament. Okay, so these are some other attachments. The iliolumbar ligament is attached here and it is present to the tip of the fifth lumbar vertebra. Okay, the faint vertical ridge on the anterior surface of each transverse process. Okay, here the transverse process, the anterior surface will give attachment to the anterior layer of the lumbar fascia. Medial to the ridge, it will be giving attachment to the psoas major muscle, and lateral to the ridge, it will give attachment to the quadratus lumborum. From here you can see that this transverse process, anteriorly the psoas major muscle is attached and laterally the quadratus lumborum muscle is attached. Okay, so these are the attachments or the structures or the relations to the transverse processes. Now the articular processes. See here, these are the superior articular processes with the superior articular facets which are facing medially. The concave articular facets, these are the concave articular facets. They permit some rotation as well as flexion and extension. And the mammillary process. What is mammillary process? It is a small process which is attached to the or present on the tip of the superior articular process. This mammillary process will give attachment to the multifidus muscle and the medial intertransverse muscle. Okay, so what you have to remember, that on the superior articular process there is a small mammillary process. This mammillary process will give attachment to the multifidus muscle which is deep to the erector spinae and the medial intertransverse muscle. Now, how the ossification of the lumbar vertebra happens? A lumbar vertebra ossifies from 3 primary centers, one for the body and one each for each half of the neural arch. These appear in the 3rd month of the fetal life. See here, in the 3rd month of the fetal life, these 3 primary centers, they will appear in the lumbar vertebra. The 2 halves of the neural arch fuse with each other posteriorly during the 1st year, and the fusion of the neural arch with the centrum, that is with the body, occurs during the 6th year. It is very important. See here, first of all, first primary center appear in the body, and one in the one neural arch and another in the second neural arch. That is the 3 primary centers. They are appearing in the 3rd month of the fetal life. Then 2 neural arches of 2 sides, the right and the left side, they will fuse together during the 1st year of life. And the fusion of the neural arch, which has already joined together, it will fuse with the body in the 6th year of life. There are 7 secondary centers which are present in these regions. Number 1, there is upper annular epiphysis for the upper surface of the body. Then one again, there is another similar epiphysis for the lower surface of the body. That is, one was for the upper surface, one for the lower surface, then one on the right tip of the right transverse process, one on the tip of the left transverse process, one on the right mammillary process, one on the left mammillary process, and one center on the tip of the spine. Again, I will repeat. See here, from the diagram you can learn one on the upper surface of the body, one on the lower surface of the body, one on the spine, one on the mammillary process of the right side, one on the mammillary process of the left side, one on the tip of the transverse process of the right side, one on the tip of the transverse process of the left side. Okay, so these are the secondary centers, 7 secondary centers which are present in the lumbar vertebra. Now we will discuss some of the clinical anatomy of the lumbar vertebra. The lumbar region is the common site of the number of the developmental abnormalities or deformities causing symptoms ranging from simple backache to serious paralytic malformations. Number 1 is the sacralization of the 5th lumbar vertebra. What is sacralization? The 5th lumbar vertebra or its transverse process may be fused or one or both sides with the sacrum. See here, this is the 5th lumbar vertebra and this is the sacrum. Here what is happening? The left side of the body and the left transverse process, it is fused with the sacrum. This is the sacralization. Sometimes the transverse process may articulate with the ala of the sacrum or with the ilium. It can also fuse with the ilium of the hip bone. They may press on the 5th lumbar nerve because we know that the 5th lumbar nerve will cross through this area, so this sacralization can compress the 5th lumbar nerve. Sometimes the body ossifies from 2 primary centers of ossification and one center fails to develop. It results in hemivertebra. What is hemivertebra? Hemivertebra means that the one side of 2 vertebrae, they are fused to one another. That is, see here, the left sides of vertebra which is above and vertebra which is below, they are fused to one another. Now, what is spina bifida? There are many types of the spina bifida. What happens? Why there is spina bifida? Bi means 2 and fida are the branches, that the spine has been split into 2 branches. What happens? The 2 halves of the neural arches may fail to fuse together. If they fail to fuse together, they will leave one gap. What is neural arch? It is the vertebral arch which is present on the right and the left side. And as we know that these 2 neural arches, they should be fused together at first year of age. But if these 2 halves of the neural arches, if they fail to fuse together, they will leave a gap in the midline and this is named as spina bifida. Sometimes the spina bifida is present but there is no protrusion. See here, there is no protrusion through it, so that there is no swelling on the surface. This is referred as spina bifida occulta. That is, it is not obvious or not evident. We cannot see anything protruding out from the spine. So this is named as spina bifida occulta. Sometimes what happens, the meninges and the spinal cord, they are herniating out through the gap. Okay, if the protrusion of the meninges alone, if the meninges are only coming out, see here, the yellow colored nerves, they are not coming out, only the meninges are coming out. Okay, so this is named as meningeocele, that is meninges are coming out. Okay, this is meningeocele. It will form a cystic swelling which is filled with the cerebrospinal fluid. Okay, so this is the CSF which is filled in this swelling. But sometimes what happens, along with the dura mater and the pia mater and the CSF, the spinal cord is also coming out. See here, the spinal cord is also present in this swelling and this condition is named as myelomeningeocele. Okay, meninges are also coming out, the spinal cord is also coming out. So this is named as meningeomyelocele. Okay, meningeomyelocele. But sometimes what happened, there is the central canal of the herniated part of the cord may be dilated. If it is dilated, it is named as syringomyelocele. Okay, syringomyelocele. Sometimes the spinal cord may itself be open posteriorly, that is named as myelocele. Okay, if it is open posteriorly, then it is named as myelocele. So these are some of the branches or some of the types which are present in the spina bifida. Now there is one term which is named as spondylolisthesis. What is spondylolisthesis? Sometimes the greater part of the 5th lumbar vertebra, see here, here, this is the fifth lumbar vertebra. It slips forward over the sacrum. Okay, it is splitting forward over the sacrum. It is coming out and forward over the sacrum. First of all, there can be fracture. This is named as spondylolysis. Okay, this is the fracture of the fifth lumbar vertebra, and after the fracture, the fifth lumbar vertebra, it will slip over the anterior part of the sacrum. This is named as spondylolisthesis. Okay, normally the tendency to forward slipping is prevented by the fact that the inferior articular processes, see here, these are the inferior articular processes of the fifth lumbar vertebra. They lie behind the superior articular processes of the first sacral vertebra or sacrum. These are the first superior articular processes of the sacrum, and these are the inferior articular processes of the fifth lumbar vertebra. Normally what is happening? Normally these inferior articular processes of the fifth lumbar vertebra, they are present posteriorly, okay, and these superior articular processes of the sacrum, they are present anteriorly. But sometimes, however, the inferior articular processes, the spine and the lamina of the fifth lumbar vertebra, they are separate from the rest of the vertebra due to an anomaly in the ossification. If they are separate from rest of the vertebra, the body of the vertebra can now slip forward. It will come forward. See here, it is coming forward on the sacrum. Okay, it can be a cause of the backache and pain radiating along the course of the sciatic nerve, and which will cause sciatica. What we have learned in this, there is spondylolysis, that is the fracture or there is separation of the spine, the inferior articular processes from the body of the fifth lumbar vertebra. These parts, the inferior articular processes and the transverse processes, they were preventing the fifth lumbar vertebra to slip forward, okay, because there was a gap, and in this gap this first or the superior articular processes of sacrum were present. But now because they have been fractured or these parts have been separated from the fifth lumbar vertebra, so now the fifth lumbar vertebra will slip forward on the anterior part of the sacrum. There can be fracture and dislocation. Fracture and dislocation of the lumbar vertebra will result in the Cauda equina syndrome. See here, if the fracture, the body of the vertebra get fractured, so what will happen? There is Cauda equina here in this region at first lumbar vertebra, which is the ending of the spinal cord. But if the fracture happens, all part, the nucleus pulposus and this disc will be, the intervertebral disc will herniate backward, and it will be giving pressure on the Cauda equina, that is named as Cauda equina syndrome. This Cauda equina syndrome will be characterized by flaccid paraplegia. Okay, there will be paraplegia, there is saddle shape area of anesthesia and analgesia. Okay, then sphincter disturbance in the form of incontinence of urine and feces and impotence will happen. These are four characteristics which are present in the Cauda equina syndrome. What is Cauda equina syndrome? The Cauda equina, which is the end of the spinal cord, it is compressed by the fracture and dislocation of the lumbar vertebra. See here, this is disc degeneration. After second decade, the degenerative changes set in resulting in the necrosis with sequestration of the nucleus pulposus and sometimes the softening and the weakness of annulus fibrosus.